Hello everyone, this is Professor Youssef, and today we're going to be covering our final topic of the anatomy and physiology curriculum, and that's going to be the reproductive system. As always, we're going to approach this topic in a professional and scientific manner, right? This can be a bit of an uncomfortable topic for some folks, but we're all adults, we're college students, and just like any other system that we discussed, the reproductive system is an important part of human anatomy that we as aspiring healthcare or biology-oriented professionals have to be aware of. So today we're going to begin by discussing the male reproductive system, and then we'll get into the female reproductive system as well, followed by some Mink identification, right? We did decide that for this specific lecture, we are not going to be going into the histology of the systems. Pretty involved, pretty complex. We know that you guys have plenty on your plates already with regard to preparation for your practical. So to reiterate, you are not responsible for knowing the histological aspect or identifications of the reproductive system. Okay. And just as a reminder, you guys should definitely be referring to your term sheets when you're preparing for this practical, because by using your term sheets, you're not only going to be able to distinguish between which terms on my slides are testable and which ones are there as supporting info, but you're also going to have a very clear checklist of exactly what you do and, more importantly, don't know, right? So one piece of advice I do like to just give my students is to compile kind of a master terms list. So just copy and paste the terms. They're all Word documents. Just copy and paste the terms from every lecture that's being tested on this practical 2, and just use that as a general guide so that you can spend your time nice and efficiently by focusing on terms that are troublesome instead of wastefully reviewing stuff that you clearly already know, right? So you can just narrow down that list of stuff you don't know little by little, day by day, until it's non-existent, right? Until you do know everything on those term sheets, and you should be good to go. Small things like that, along with, of course, spending ample time in the lab, self-testing with models and microscopes, that's your best bet for securing the A, right? That I know you're all capable of securing, right? We can all get that A. It's just a matter of, putting in the time and the effort to make sure that nothing less than an A is even possible, right? As always, I'm just going to put this out there. I do encourage everyone who needs some guidance to reach out to me, okay, whether it be with the actual course content or, simply crafting an efficient study approach. Not to say that, I'm some kind of study master, but, I've had my fair share of exams to study for, and I've done it both the right and the wrong way, so I do, I'd be more than happy to share what tips I've learned over the years with anybody who's interested in learning them. I hope by now you all feel pretty comfortable coming to me with anything, whether it be with regard to in-class work or effective study techniques or applications, planning for the next step, whether it be like dental school, med school, PA school, physical therapy, research, whatever it may be. I'm here to help, guys, however I can, and that does transcend the boundaries of this course. I still have students from past semesters. They keep actively keeping in contact with me. They're asking for tips and input, or they just pop in to say hi, and I love that. That's one of the great joys of being an instructor is, having those connections with the students. So please don't feel hesitant to reach out to me, and I welcome you all to feel comfortable doing the same now or even after the course is over. Now, with that said, let's go ahead and finish up this last topic and get you guys the last little bits of info you need to ace this practical. The reproductive system. So most organ systems of the body, they function from the time they are formed, and they will sustain the existing individual, right? The heart, the lungs, the brain, these things are going to, as soon as they're formed, begin working, right? Of course, with some modifications postpartum, but for the most part, we usually have that organ working from its genesis, from when it begins. However, the reproductive system begins its biological function, which is the production of offspring, at puberty. And I'm sure many of you already are familiar with that. And of course, as always, Dr. LaCroix Freilich is going to be covering the nuanced physiology of the reproductive system. But for now, in our lab course, we're just going to be focusing on the on the anatomical portion, right? I need you guys to, again, as always, just be able to identify something that I point to on a practical, right? And always think to yourself, can he test me on this, right? Because I like to give information. You guys know that I, not that I love to hear my own voice, but I do like to provide some type of substantial backbone to what I'm saying. I don't want to just throw, pictures at you and point at them and say, this is this, this is that, this is this. No. I want you to understand where I'm coming from a macro and a micro perspective, right? So that's kind of why I put in a little extra info from time to time. But, you guys know what's going to be on your test. It's on the term sheets, right? You guys know what kind of models you're going to see. They're in the lab. You know what kind of slides you're going to see. They're in the lab. They're online. So use those to your advantage. All right. So let's begin with the male reproductive anatomy, okay? And these are the essential organs of reproduction are going to be the gonads, right? In both male and female, we have gonads is the proper term. These are the sex organs. And so for males, it'll be the testes. For females, it'll be the ovaries. And these are going to produce the sex cells, or better known as gametes, right? And also some of the sex hormones as well, estrogens, androgens, right? Testosterone and things of that nature, progesterone. Now, the reproductive role of the male is to manufacture sperm and deliver them to the female reproductive tract, right? The female, in turn, produces eggs. And if the time is suitable, the combination of sperm and egg produces a fertilized egg, right, a zygote, and that's the first cell of a new individual, okay? Now, once fertilization has occurred, that's the joining, the union of the sperm and the egg, becoming a zygote. Once that fertilization has occurred, the female uterus is going to provide a nurturing, protective environment in which the embryo, right, later called the fetus, develops until birth. So right now we're looking at just a general schematic of the male reproductive system, right? This is a sagittal view. And we are going to kind of break it down piece by piece. So let's go to this next slide. And this is going to be a sagittal pelvis model as well. Note the difference in orientation from the last slide to this slide, right? We're facing one side, now we're facing the other, right? So this is kind of just an overview of the path that sperm takes from its maturation to its release from the body, which is also referred to as ejaculation. We're going to speak a little bit more closely about each of these structures as we proceed, and indeed you may already be familiar with several of them from our previous discussion on the urinary system, right? And that's going to help a lot with identification, as you'll note as we go through. So let's go to this next slide. Okay, so the primary reproductive organs of the male are going to be the testes. And these are going to produce sperm and the male sex hormones, testosterone is another word. And all other reproductive structures, are ducts or sources of secretion, right, glandular. And they're going to aid in the safe delivery of sperm to the body's exterior or to the female reproductive tract, if fertilization is the objective. So these paired oval testes lie in the scrotum outside of the abdominopelvic cavity. You can see them labeled over here. And the temperature there is slightly lower than body temperature. This is a requirement for producing viable sperm, right? And so the scrotum actually does have a muscular mechanism that it's kind of a feedback mechanism that assists to maintain this temperature requirement, such that if, for example, if it's cold out, the scrotum will actually contract in a way that it pulls the testes closer into the body so that it can use the body's heat to maintain that temperature requirement, right? And the same thing goes for when it's too warm out, and the scrotum will then loosen up or relax, allowing for the testes to move more freely away from the body, right, and kind of dissipate some of that heat to the outside. So let's zoom in on this next slide, slide 5, into a bit more of a closer look at these testes. And as you can see, there are going to be several substructures that you need to be able to recognize on your practical. let's start with it. Each of these testes is covered by a dense connective tissue capsule. We're going to call that the tunica albuginea. Albuginea is, this literally means white tunic, right? You can see that over here. It's a tunic albuginea, and there's also a more superficial layer around that called the tunica vaginalis, right? And that kind of has a visceral and a parietal layer, like we saw with the pericardium, for example, right? We're going to be more focused on the tunica albuginea, this dense connective tissue capsule kind of surrounding the testes. So extensions of this sheath enter the testes, and they're going to divide it into a number of lobes. Okay, and each of these lobes are going to house 1 to 4 highly coiled, what are called seminiferous tubules. And these are your sperm creating, your sperm forming factories. So these seminiferous tubules of each lobe are going to converge, right? Here we have the seminiferous tubules. They're all going to converge, right, to empty the sperm into another set of tubules called the rete testes. The rete testes, or the rete testes, however you want to pronounce it, just spell it right. And that's going to be at the posterior side of the testes over here. Okay. And these sperm traveling through the rete testes are then going to enter what's called the epididymis, right? And that's going to kind of be this little cap that's covering the front and posterior, top and posterior, superior posterior aspect of the testis itself. So this epididymis is going to be kind of like an elongated structure running up the posterior and lateral side of the testes, and it's going to cap at the superior aspect, like we just said, and it's going to form the first portion of the duct system, right? The pipes, pretty much. And it's going to provide a site for immature sperm entering it from the testes to kind of complete their maturation process, right? They're born, so to speak, in the testes, and then they mature in the epididymis. Okay. So what I need you guys to be aware of here is that the accessory structures forming the duct system, right? So basically the tubes, homologous to the urinary system, the ureters, the urethra, right? So the tubes that are moving stuff, right? In this case, sperm. That's going to be our ductal system, right? So these accessory structures forming the duct system are going to be the epididymis, the ductus deferens, which is more commonly referred to as the vas deferens, the ejaculatory duct, and the urethra. And we're going to go through these a little bit more in depth as we go. Now, let's take first a look at what is over here and called the ductus deferens, aka the vas deferens. This is going to be, and this is another word for sperm duct, pretty much. And this is going to be arching superiorly from the epididymis. Is going to pass through the inguinal canal into the pelvic cavity. And you might remember from our ortho lecture back in A&PII what the inguinal canal is, right? We have those little notches in the pelvis that allow for the passage of vessels and things like the vas deferens, for example, through, right, into that pelvic cavity. So this vas deferens is going to go into the pelvic cavity via the inguinal canal and course over the superior aspect of the urinary bladder. We can't really see that in this image, but you're definitely going to have several images to come that, that'll become abundantly clear. Okay. And we're also going to talk in a little bit about the spermatic cord, which contains the vas deferens and also some of the vasculature, the arteries and the veins that supply the testes and the testes drain into, right? Do be aware of the different portions of the epididymis. For example, we have the head of the epididymis, which is going to be this more superior portion that's kind of capping the superior aspect of the testes. We have the body of the epididymis, right? That's going to be kind of a little more obviously in the middle over here in this area, right? The body of the epididymis. And then finally down to the most inferior aspect, we have what's called the tail, of the epididymis. Okay, so just do be aware of those distinctions. Same thing that we saw with the pancreas, for example. The head, body, tail. Okay. So here is another look on slide 6 of the male reproductive anatomy, and we're getting a little bit more of a macro and then a micro view on the right. In life, the vas deferens is going to be enclosed, along with some blood vessels and nerves, in this connective tissue sheath, right? Notice there's a lot of connective tissue here, right, that are protecting and kind of keeping compartments where they're supposed to be. And that connective tissue sheath that's enclosing the vas deferens along with these blood vessels and nerves, that's what we call the spermatic cord, right? The spermatic cord, you can see it much more clearly on the right over here, right? You have the spermatic cord, and that's going to be housing all of these very delicate structures, right? Now, let's move on to this next slide. And we can see that the terminus of the vas deferens over here, right? The terminus of the vas deferens is going to enlarge to form this region called the ampulla. Okay, and the ampulla, just like what we saw with the vestibular system, for example, right? The ampulla, the cristae ampullaris, we're in that ampulla. It's just a widening, right? A widening of that long, narrow tube. So the end of this ductus deferens, this vas deferens, is going to be kind of enlarged, forming that ampulla, and that ampulla is then going to empty into what we call the ejaculatory duct. Okay, this is the ejaculatory duct that we're seeing over here, right? And so during ejaculation, contraction of the ejaculatory duct is going to be what propels the sperm through the prostate to the prostatic urethra, which then in turn is going to empty into the intermediate part, right, the membranous urethra, and then finally into the longer spongy urethra, which is going to run through the length of the penis to the body exterior. Okay, so let's just take another look over here. We have the testes, we have the epididymis on top over here. It's going to have the head, the body, the tail, and that is going to extend into what we call our vas deferens, right? Vas deferens is going to go up all the way around to the anterior portion, right, of the bladder, the urinary bladder, which we're all familiar with by now. You can see those ureters emptying in, and that vas deferens is going to kind of widen at its terminus at the end into an ampulla. The ampulla is going to dump into this ejaculatory duct, right? And then it's going to travel throughout the remainder of the urethra. Okay. So the accessory glands that we're talking about here, right? So these are going to be kind of assisting with the movement or the transportation of sperm. It's not necessarily the actual, productive parts, right? It's not the factory of sperm that, is responsible for the creation and maturation. These are going to be accessory glands. And those going to include the prostate, the seminal glands, also known as the seminal vesicles, right? And the bulbourethral glands. And these glands are going to produce seminal fluid. Okay, seminal fluid is going to be the liquid medium in which sperm leaves the body. So seminal fluid is going to be different from sperm, right? And sperm and seminal fluid are also going to be different from semen. Now, semen is going to be, remember how we talked about the renal corpuscle, how that's going to be the glomerulus and the Bowman's capsule, and then we refer to them collectively as the renal corpuscle. It's a similar idea here. So seminal fluid plus semen, plus sperm, seminal fluid plus sperm equals semen. Okay, so semen consists of sperm and seminal fluid, and this seminal fluid is usually going to be pretty overall alkaline, right, higher pH, and that's going to be important to help kind of buffer the sperm against the relatively acidic environment of the female vagina. And if we're looking at the prostate gland, that's going to be mainly responsible for the secretion of that alkaline fluid. The seminal vesicles more so responsible for secreting fructose and prostaglandins. These are going to help a lot with fueling the sperm, the individual sperm, because as we know, they have little flagella at the end, and they're going to, they require energy, ATP, in order to be able to function and to be able to move and migrate. And the bulbourethral gland is going to secrete more of like a mucus-like fluid. That's also going to help kind of with the transportation of sperm into either the external environment or into the female vagina, which during coitus could result in fertilization of an egg. Okay. So moving on to this next slide, kind of just a representation. We're not going to get too crazy into it. It's a lot of the same thing that we just talked about. You can see the testes, epididymis on the superior lateral portion of it. And that vas deferens is kind of traveling upwards. We can see the bladder kind of up there, right? Over here is the bladder, right? And then that seminal vesicle over here kind of popping out on the side, seminal vesicle. And then ultimately it's all going to kind of just dump into this urethra, right? We're going to see the prostate kind of lining the prostatic portion of the urethra. And then we have that membranous little piece, and then the longer spongy urethra, right, going through the length of the penis. On the right, we can see the cadaveric donor specimen, right, of the testes, and it does look, quite similar to what we see on the diagrams, right? We can see that epididymis, we can see the head, body, and tail. We can see that spermatic cord, right, and it seems like some of the spermatic cord may have been stripped away because we can see some of the nerves and some of the vasculature right around here. We can see that vas deferens, right? So this is just to kind of give you a better perspective. Okay. Again, over here, very similar to what we already discussed, just different views. On the left, we have exactly what we just talked about pretty much. You can see that prostate labeled now, right? They also label the ureters just so you can kind of get an idea of where they're entering into the urinary bladder, right? You have the vas deferens in blue, just kind of going up all the way around the superior portion of that bladder, and then dumping into the back into that ejaculatory duct. All right. Here we have a posterior view. Okay, we have that urinary bladder again, which is usually a pretty good landmark to look for, right? If you can't find that, then go, look for the kidneys and whatever is connected to the kidneys, right? By two tubes, those ureters. It's probably going to be your urinary bladder, right? And we can just kind of see what's going on there from the posterior aspect. And on the right, we also get another look at the cadaveric view, right? So overall, pretty consistent with what we've seen in the diagrams. Again, here we have the ejaculatory duct, right? You have that prostate gland we can see over here in red, right? We have on the left in red the bulbourethral gland, which is going to be this little tiny dot on the right that you can see over here, this bulbourethral gland. This is commonly referred to as the Cowper's gland, Cowper's, C-O-W-P-E-R. Apostrophe S, Cowper's gland, and you might see either bulbourethral or Cowper's gland in the literature, so don't be surprised if that pops up. And just guys, take a look at these. Just get a general idea of the orientation of where things are moving, where these quote unquote pipes are flowing, and how they travel to get to the right place. Okay. And we already covered this. Over here, slide 11, we covered this already in urinary, but here's a quick little review of those three different parts of the urethra, right? We have our prostatic urethra, and that's going to be this part that is kind of surrounded by your prostate over here, this large kind of rounded gland looking thing that's directly inferior to your bladder. There's actually something referred to as benign prostatic hyperplasia, I believe it's referred to as, and that's usually going to be like an enlargement, right? It's going to have some kind of cellular changes in the prostate, and this usually happens to males as they age. Typically over the age of 60, you're going to have more frequent prostate issues, right? And as that prostate enlarges via the hyperplasia, you're going to sometimes have that pushing up against the bladder. Sometimes it might squeeze the prostatic urethra, and that that can cause difficulty or irregular urination. It can cause frequent urination, right? Similarly to what we see with a female, as they're during pregnancy, right? As the uterus gets larger and larger, it kind of pushes on that urinary bladder, making it smaller. Honestly, it can't distend as much as it used to be able to before pregnancy. But anyway, that's just a side note. We see that prostatic urethra right here. We can see the membranous urethra, very, very small sliver, very small little piece over here. You can usually see that kind of directly below the prostate, right? And then finally we have the spongy urethra, right? The penile urethra. It's going to be going throughout the length of the penis, like we saw in urinary. So nothing new there. So these next couple slides are going to have to do a bit more with the male penis, and this is going to be the main external copulatory organ of the male reproductive system. Copulation is going to be referring to coitus, right? Sex, sexual intercourse between male and female, in which fertilization could be achieved. Okay, so looking at this slide, we have a few different schematics, right? This is kind of showing the, on the right you have the cadaveric view, right? We have the cadavers that have been, and the penis has been cut. It's been, bisected so that we can see these different regions, right, that are eventually, we're going to talk about a bit more, but these are going to be known as the different cavernosa. We have the corpus cavernosum, the corpus spongiosum, and they're going to be very important during erection, right, to allow for proper penetration. And let's just move on to this next slide. So over here, we can see that there are many different regions that we have to be aware of. So the penis, which is part of the external genitalia of the male, along with the scrotal sac. Again, that's going to be the copulatory organ of the male. And this is going to be designed to deliver sperm into the female reproductive tract. It consists of a body or a shaft, and this is going to terminate in a relatively enlarged tip, and that's going to be the glans, the glans penis. And you have some skin covering the penis. It's kind of loosely applied at the end of that glans. And it reflects downward to form kind of a circular fold of skin. We call the prepuce, or the foreskin, as it's more commonly known as. And that's going to kind of go around the proximal end of the glans. Okay, and this foreskin may be removed in the surgical procedure that is known as circumcision. Whether, it could be for religious purpose, sanitary purposes, aesthetic purposes, all kinds of reasons that people do circumcisions. Typically as a baby, it's a little bit less traumatizing than as an adult, from what I've read. But the different regions we should be aware of: there's a root, which is going to be composed of the crura, and this is going to kind of allow for the attachment of the penis to the pelvis. There's the shaft, like we just talked about. This is just the elongated tissue portion. And then finally the glans, which is going to be the head of the penis, the little tip. So the foreskin, or the prepuce, I don't actually know the proper pronunciation. Foreskin works fine. You can write that down on the practical. And this is going to just cover the glans, and this is removed during circumcision. There's a schematic on the bottom right kind of showing how that works. Now, slide 14, this is going to kind of go into the internal penile anatomy. So internally, the penis consists primarily of 3 elongated cylinders of erectile tissue. These are going to engorge with blood during sexual excitement, pre-coitus, before sexual intercourse. And this causes the penis to become rigid and enlarged so that it may more adequately serve as a penetrating device. Right? This event is called erection. And the paired dorsal cylinders are going to be what are known as the corpora cavernosa, right? And then you have the single ventral corpus spongiosum, and that's going to surround the spongy urethra. Okay, so corpus cavernosum is going to be these 2 paired regions of tissue we can see on the right over here. This is going to contain the deep artery of the penis. This is how blood is able to enter and do its job, play its role during erection. And then we have the singular corpus spongiosum, more inferiorly located in the bottom here. And this is going to be one region of tissue containing the penile urethra. And this spongy tissue of the corpus spongiosum, that is kind of what prohibits the crushing, right, or the flattening of the urethra during erection, because obviously in order for sperm to exit, there needs to be, an open patent pathway for that sperm to exit. So, this corpus spongiosum kind of functions in that regard. Okay, let's cover a couple other landmarks you guys can use to get oriented. Back to our bone lecture in A&PII, we can see this pubic symphysis over here, right? This is always going to be anterior, the pubic symphysis. This is going to be kind of where the two os coxa are meeting. We're going to see that more in the anterior portion. With males, it's a lot easier to distinguish what is anterior and posterior. Obviously, you're going to have the penis and the glands toward the anterior portion, with the anus and rectum more posteriorly located, right, with that gluteus maximus in the back. Urinary bladder, this is a big one, guys, right? We can see the ureters dumping into, if we looked up a little higher, we would, if it wasn't cut off, we would see kidneys, dumping into the ureters dumping into the urinary bladder and emptying through the urethra, right? Entrance and exit is going to be that trigone that we talked about during urinary. Okay, we have the rectum and anus that we can see over here, part of our GI discussion. So here's that rectum, here's the terminal end of our colon, the large intestine, and then the anus over here. And of course we have the scrotum, which is going to house the testes, right? Kind of bring a protective mechanism and also a temperature regulation mechanism as well. Okay, and that about covers it for all your need-to-know terms regarding the male reproductive system. Now, let's move on to the female side of things. Female reproductive anatomy is just as complex as what we saw in males, and it does require us to discuss not only the reproductive organs themselves, but just like we saw in males, there are also accessory structures involved in the reproductive process, such as the lactation apparatus that we know of now as the mammary glands, right, in production of milk for newborn babies. Let's start with some more of the external structures, beginning with the vulva, right? So the external genitalia, the vulva, this is another word or nomenclature that we can use to kind of just describe the overall structures that surround the opening to the urethra and the vagina. So these are going to be your more external genitalia. And these are going to consist of the mons pubis, the labia majora and minora, the clitoris, and the external urethral and vaginal orifices, also with the hymen and the greater vestibular glands. Okay, so this image summarizes the basic structures of the female external genitalia. So let's go through these one by one. So let's start with the mons pubis. The mons pubis is just the pubic mountain, mons, right? And that's going to be just a rounded, fatty eminence that cushions the pubic symphysis. That we just talked about that, the pubic symphysis. So, of course, that's going to be on the anterior portion, right? And this is going to be covered with coarse pubic hair after puberty, right? Development of pubic hair is going to usually take place in the beginning and middle stages of puberty. And we're going to see that covering the mons pubis, which can be seen right at the superior portion of the image. Next, we have what's called the labia majora. Singular is going to be the labium majus, but typically labia majora is the more common nomenclature we use. And this is going to be, well, the labia in Latin means lips, right? So they use the same terminology as they would for, of course, the lips on the face. Labia majora is the larger lips, and the labia minora is smaller. We have two of each. So the labia majora is going to be these two elongated, hair-covered skin folds that are going to extend from the mons pubis. And they contain sebaceous glands, some apocrine glands, and adipose tissue. We all know what sebaceous glands and apocrine glands are by now. Adipose tissue, of course, being fat. And these are going to be, the labia majora is kind of homologous to the scrotum in the male reproductive system. Okay. And next we have more medially, right, is the labia minora, right, or singular labia minus. And this is going to be two smaller folds located medial to the labia majora. They don't have hair or adipose tissue, but they do have many sebaceous glands. Next, we're going to move into what's called the vestibule. Okay, and the vestibule, as you can see over here in this image, is going to be that region located between the two labia minora. Okay, so all that whole area over here. And from anterior to posterior, it contains the clitoris, the external urethral orifice, and the vaginal orifice. Okay, the external urethral orifice is simply the opening through which urine can leave the body, right? That's just the hole where the ureter, or where the urethra ends, pretty much, into the external environment. And of course, the vaginal orifice is going to be the entrance into the vagina. So next we have what is called the clitoris. This is going to be a very small mass of erectile tissue located where the labia minora meet anteriorly. And this is going to be homologous to the male penis, right? This contains erectile tissue and is a major site of sexual stimulation, right? And it will engorge with blood similarly to what we see with the male penis during sexual excitement. Okay. We also have what's called the prepuce of the clitoris. This is kind of analogous to the foreskin of the penis. This is going to be some skin folds formed by the union of the labia minora, and they're going to serve to kind of hood the clitoris. This is like a clitoral hood is another term that's often used. And we already discussed the external urethral orifice, right? Just the outlet for the urinary system. There's no reproductive function in the female, really. It's just strictly urinary. There's also something referred to as the hymen. This is going to be a thin fold of vascular mucous membrane, and it may partially cover the vaginal opening. Sometimes this needs to be ruptured, or this does get ruptured during penetration. First time having sexual intercourse, there may be bleeding because of the ruptured hymen. This is typically normal, albeit painful from what I understand, but we also have what's called the greater vestibular glands, and these are going to be right over here, greater vestibular glands. Pea-sized mucus secreting glands. They're going to be located on either side of the hymen, and their job is to lubricate the distal end of the vagina during coitus, during sexual intercourse. So this is going to allow for more for smoother, less friction during penetration during coitus, which is just another word for sex. These are going to be homologous to the bulbourethral glands of males. So that lubricating fluid, that mucus-like secretion, similar to what we see in males, is going to be taking place in the greater vestibular glands. Okay. Now this diamond-shaped area over here, the region between the anterior end of the labial folds, the ischial tuberosities laterally, and the anus posteriorly, is called the perineum. Okay, so this is going to be the perineum. Typically, you can just look at it as from the bottom of the vagina to the beginning of the anus. That's usually going to be your perineal area. This is not to be confused, guys, with peritoneum. That's totally different. The perineum is going to be in that pubic region. The peritoneum, right, is going to have that peritoneal cavity. For example, like the kidneys, we know are retroperitoneal, right? Okay, so let's look kind of from more of a sagittal perspective now, right? And remember, guys, what do I always stress to everyone during class, regardless of the topic? Orient, 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 orient. You need to be able to appreciate the location of these various structures and landmarks from multiple perspectives. right? You can't be sure whether you'll be given a sagittal section or a coronal or a layered model, right, with certain portions folded up or reflected, right? So it's important to become familiar with how these things look from any which way, right? And that is the indication of true mastery. You know, if you can look at something from any perspective, upside down, you're upside down and spinning around, you know what it is and you know what is where, what should be where. That's going to make your life a lot easier on the practical, especially because it's timed, right? We don't have time to be sitting there, you know, thinking back to, oh, scratching our head, thinking, oh, wait a minute, was it on this side? No, you guys should be comfortable, right? If I show you any sectioning, any model, you guys should be aware of this is the, I'm looking at the posterior aspect of the internal anatomy of the female reproductive system. I'm looking at the sagittal view, right? You should know which side is anterior and posterior, right? You should know that, as you can see from this image, it's a lot harder to tell without the existence of the penis and scrotum. You know, if it wasn't for the gluteus over here kind of protruding outward, it's hard to tell what is where, right? Of course, you can look at the rectum and the anus, but oftentimes I've seen this get confused with the vagina and the uterus, right? So become familiar with what should be where. You're going to have that urinary bladder a lot more anterior, right? A little bit inferior to the uterus. You're going to have the uterus anterior to the rectum, right? To that colon area. Okay, so become familiar with that. So again, we see some of these key structures that look quite different from what we saw on the last slide in the anterior perspective, right? So if we go back, very different, right? It does not look the same. We have to know what we're talking about to really be able to intelligently move forward here. So now that we've covered the external, right, the primary external structures, let's talk more about the internal anatomy of the female reproductive system. And this is where most of the functional aspects are going to take place. Okay, so just kind of staying on this sagittal view, right, and just please do note from this slide, slide 19 to slide 20, note that we are now facing in different directions, opposite directions, right? It's still a sagittal view, but instead of facing toward the left, now she's facing toward the right, right? So please do be aware of that. Take time to orient and to make sure you know what you're looking at and from what perspective. Okay, this really can make a big difference. Okay, now the internal female organs are going to include the vagina, the uterus, the uterine tubes, the ovaries, and the ligaments, and like the supporting structures that are going to suspend these organs in the pelvic cavity. They're not just floating around in there. They need some support. They need suspension ligaments and structures that are going to, you know, keep them in place where they should be. Now, let's start with the vagina. This is going to extend for approximately 10 centimeters, about 4 inches from the vestibule to the uterus superiorly. It serves as the copulatory organ because it receives the penis and consequently semen during sexual intercourse. And the vagina also plays another role in that it provides a passageway for the delivery of an infant, right? And also for menstrual flow during menses, which we'll discuss in a little bit more. You'll note that I tried to emphasize the terms you need to be focused on in red because there are just so many structures here that we're not going to be able to cover, but the ones in red, you know, for the most part, please do double check with your term sheets. But for the most part, these should be the ones that you're spending your time on. Okay. Now, let's look at the very same structures we just saw, but this time from a posterior perspective. And you might be tempted when you first saw it to call this an anterior perspective, but it's not, as indicated by this this little schematic on the bottom right-hand corner over here, right? That's understandable too. At first, I'm going to be honest, at first I thought it was anterior as well until I looked a little bit closer. I was like, wait a minute, this orientation isn't quite. And then I looked at the bottom right and oh, okay, this is the posterior perspective, you know, light bulb. It's cool, right? It happens to the best of us. It's not likely to cause too many issues, right? The anterior versus the posterior, like the structures are pretty clear. It's not going to cause issues during the exam, I don't think, but it is worth pointing out, right? And if you really want to maximize your studying, you know, you can take note of the entrance and exit points of certain structures, like these ligaments, right? The ovarian ligaments, round ligament, right? The broad ligament. You can and those can kind of sometimes be a little giveaway of what we're looking at and what position we're in. But anyway, let's begin right over here with the uterus. All right. Here's our uterus. This pear-shaped uterus, which is situated between the bladder and the rectum, is going to be a muscular organ with its narrow end down here, the cervix, directed inferiorly. Okay, now the cervix is going to be an extension of the uterus. This is what is going to be, oh, she's 6 centimeters dilated, right? The cervix is what they're talking about, dilated. This is usually going to be relatively narrow, right? And then during pregnancy, as the fetus is trying to exit via the birth canal, that is when the cervix has to open up, and that's when you have what's called cervical dilation. And that's going to be toward the inferior aspect of the uterus, right? Where the fetus is housed for the entirety of its development. Okay, so this major portion of the uterus is going to be referred to as the body, right? So just as we talked about in other organs, right? The stomach, the pancreas, the epididymis, like we just talked about, there are going to be portions. So the major portion of the uterus is going to be the body. Okay, it's over here. Its superior rounded region above the entrance of the uterine tubes is going to be called the fundus, right? The fundus is going to be way up here. And a fertilized egg is going to be implanted in the uterus, right? So that's going to house the embryo or the fetus during its development. So we want to see implantation of that fertilized zygote in the uterus. Now, in some cases, this is a very sad occurrence that takes place sometimes, but in some cases, the fertilized egg may implant itself in a uterine tube, right, into a fallopian tube, which we'll talk about more in future slides, or sometimes even it'll implant itself on the abdominal viscera, and that can create what's called an ectopic pregnancy, which could be fatal, extremely dangerous. And these kind of implantations are usually unsuccessful, and of course they may endanger the mother's life, because these uterine tubes, these fallopian tubes, they're not made to accommodate the increasing size of a potentially 8-9 pound baby. Right, it's not gonna work that way. That's the uterus's job. It's it's built to house the fetus as it increases in size. So ectopic pregnancies can be devastating, and it's important to of course prenatal exams and speaking with your OBGYN during pregnancy, and of course taking your proper supplements. These little things do make all the difference in the world, right? Because this is it's a complex and frankly, miraculous, beautiful process, but it can be dangerous, and it's important to monitor and to be aware. And then especially as treating healthcare professionals, being aware of different states of pregnancy and different potential complications, this could lead to, this could yield a lot of insights into your treatment plan on how to take care of a patient. But I digress. Next slide, in slide 22, if we look a little bit closer, we're going to notice this landmark called the endometrium. Okay, this is going to be the deepest of the 3 primary layers that compose the uterus. So just to kind of back up a little bit, the uterus is going to contain 3 main tissue layers. From superficial to deep, we have what's called the perimetrium, right? Kind of like we had with the pericardium, for example, right? The what's the word I'm looking for? Periosteum. Sorry. Ugh, mind fart. Perimetrium is going to be around, right? The perimeter. Perimetrium is going to be that connective tissue, right? Kind of like what we saw with the tunica albuginea, right? It's going to be that dense connective tissue that's kind of protecting and housing the structures within. Next, right, we're going from superficial to deep. Next, in the middle layer is going to be the myometrium, right? That's going to be your smooth muscle, myo muscle. And, you know, just like we had the myocardium, right? We had the pericardium, the myocardium, the endocardium. And we have a similar trend over here, which kind of brings us to our deepest layer, which is referred to as the endometrium, within metrium. So endometrium is going to be epithelial tissue. And by now, I'm sure, you know, we're all sick of epithelial tissue and slides, but luckily there's no histo that you guys have to have to be tortured with on this topic. But the endometrium is going to be epithelial tissue. And that's the only layer I'm going to ask you guys to identify on the exam, right? It's I'm not going to really get into the perimetrium and myometrium. Just, you know, do be aware that they're there. There are 3 layers. But the endometrium is the one that I'm really interested in testing you on. And this is going to be simply a thick mucosal layer of epithelial tissue lining the uterus. And it has 2 layers of its own, right? So if we break down, you know, for example, like remember we talked about the muscularis externa, right? Sometimes in the urinary system, for example, it'll have 3 different layers of muscularis within that muscularis externa, right? The outer longitudinal and the inner longitudinal and the middle, you know, circular layer. But, you know, I don't want to confuse everyone, but there are 2 separate layers composing the endometrium. It has a superficial functional layer, which we know as the stratum functionalis, and this is going to slough off periodically, about every 28 days, in response to cyclic changes in the levels of ovarian hormones in the woman's blood, right? So this sloughing off process, which is accompanied by bleeding, is referred to as menstruation or menses. You might hear either term. This is when a woman gets her period, right? Every 28 days. Now, the deeper basal layer, right? The stratum basalis, basalis, the stratum, the layer, the basal layer. The stratum basalis forms a new functional layer after menstruation ends. Okay, so the stratum functionalis is going to be what is coming off during menstruation, and then the stratum basalis is going to be kind of near that basal lamina, producing new endothelium or epithelium to help line the uterus as it prepares for the next menstrual cycle. All right, so let's continue into this next slide, 23. The uterine, or better known as the fallopian tubes, which we see over here, these are going to be about 10 centimeters long, which again, about 4 inches, and they're going to extend from the ovaries in the peritoneal cavity, peritoneal, not perineal, peritoneal cavity, to the superolateral region of the uterus. Superolateral, right, it's the top side portion, right, of the uterus. And the distal ends, we should all be familiar with proximal and distal by now, right? The distal ends of the tube are going to be these funnel-shaped structures that have finger-like projections. We're going to call those fimbriae. Fimbriae or fimbria, however you want to pronounce it, okay? And we can see those over here, right? We can see the fimbriae, and they're going to be having these kind of finger-like projections at the very distal portion of our fallopian tube. Okay, now, unlike in the male duct system, there's no actual contact between the female gonad, between the ovary and the initial part of the duct system, which is the fallopian tube. So the ovary and the actual fallopian tube aren't actually touching each other. It might look like they are, but that's kind of just the way the image is formed, but they're actually not. And what does that mean? That means that the eggs that are being released, right, from the ovaries, they're kind of just dropping into the peritoneal cavity. They're just kind of hanging out in space for a little bit. Because of this open passageway between the female reproductive organs and the peritoneal cavity, reproductive system infections like gonorrhea or other STIs, sexually transmitted infections, also called STDs, right? Older term STDs, sexually transmitted diseases. STIs is a little bit more modern, but because of that open passageway, these STIs, like gonorrhea, for example, right? These can cause widespread inflammation of the pelvic viscera, of the organs in the pelvis. And this can be, of course, devastating. And it's referred to as a condition called PID, pelvic inflammatory disease. Pelvic inflammatory disease, and that can be, very devastating, not only to the reproductive organs, but other organs within the pelvic region. Okay, so, we'll just leave it at that. But going back into our anatomy, within the ovaries, right? So within the ovaries, the female gametes, or eggs, as we call them, gametes being the sex cells, right? So the ovaries are going to say the sex organs, gametes, the sex cells, and then females, those are the eggs, right? The ovum. They're going to begin their development in these sac-like structures called follicles, okay? And the growing follicles are also going to produce estrogens, right? Estrogens, as we know, are going to be those steroid hormones, the female sex hormones. They're present in both male and female, but far more abundant levels in females. So when a developing egg has reached the appropriate stage of maturity, it will be ejected from the ovary in an event called ovulation, right? And this is usually the best time to attempt fertilization, to attempt pregnancy, right? So the ruptured follicle is then going to be converted to a second type of endocrine structure called what's called the corpus luteum. The corpus luteum. I'm not going to test you on these things, but you're going to certainly hear about them as you go on through your studies, if not, in this course from Dr. LaCroix-Freilich. But that corpus luteum is going to secrete progesterone, which is a different type of steroid hormone, very, very close in structure to estrogen, which is also very, very close in structure to testosterone, right? Estrogen and testosterone are, very chemically similar if you look at the actual stereochemistry of the, the way that they're built. There's something called aromatization, in which you'll have the conversion of one to another. Sometimes you have something like tamoxifen, for example, right? A drug that is an aromatase inhibitor, right? And these are often used in cases of breast cancer, where you want to kind of minimize the excessive release of estrogen or excessive production of estrogen. Anyway, again, this is just the background stuff that I'm giving you to kind of make it more of a story as we go through, and not just this is that, this is this. Anyone can do that, but that corpus luteum secreting progesterone, some estrogens, and that's going to ultimately, the elevation and decrease of those levels is going to ultimately render the timing of the menstrual cycle versus ovulation, and this is kind of what forms that whole menstrual cycle, right? These hormones, and that's basically the manner in which pharmacological interventions like birth control, for example, that's how they work, right? By manipulating these levels within the body. Now, moving forward, the ovulated egg, right? An ovulated egg that we are going to see released from these flattened almond-shaped ovaries, right, which we see lying adjacent to the uterine tubes. These ovulated eggs are kind of floating out in the middle of nowhere, right? These ovaries are not actually connected to our fallopian tubes. Now, when I say fallopian tubes, uterine tubes, they're the same thing, guys, right? You're going to hear me use both. And I'll accept either one on the practical. So they're not actually connected like we see in the male ductal system. So consequently, an ovulated egg, which you can also call a secondary oocyte, right? An egg cell, oocyte. That ovulated egg is going to enter the pelvic cavity, right? Kind of just floating around. And it's actually going to be the waving fimbriae. The waving fimbriae, these finger-like projections, the waving, flagella-like motion of these fimbriae of the uterine tubes. they're going to create fluid currents that, if successful, are going to draw the egg into the lumen of the fallopian tube, right? So they're not actually connected, but the flapping and the waving of these fimbria are going to kind of make a current that brings the ovulated egg into the fallopian tube, okay? And then there, the egg can begin its passage to the uterus, which is going to be propelled by the cilia of the tubule wall. So that fallopian tube has little cilia within it that are also going to be kind of flapping away and function to kind of, not quite peristalsis, but similarly kind of move the egg downward through from the distal portion to the more proximal portions of the fallopian tube. Now, the usual and more desirable site of fertilization is going to be in the uterine tube. Now, note I said fertilization, not implantation. Fertilization, just when the sperm meets egg, right? We want that usually to happen in the uterine tube, in the fallopian tube, okay? Because the journey to the uterus for the egg takes like 3 to 4 days, right? And an egg is only viable for 1 day, for 24 hours after it leaves the ovary. So that math isn't mathing for me. Thus, therefore, the sperm must swim upward through the vagina and uterus and then into these fallopian tubes in order to reach the egg in time. Okay, and this is a pretty arduous journey because, right, they're swimming against this downward current that's created by the ciliary action that we find from the cilia inside of these fallopian tubes. So they're pretty much swimming upstream, right? So if you're listening to this today, you are the derivative of the sperm that won the race. So congratulations, you win gold medal. Excellent. And you know, I believe there are about 300 million sperm in the average ejaculation. So, you know, you're not just 1 in a million, you're 1 in 300 million at least. So, okay, there we go. Let's go ahead and move forward into our next, hang on, get my pen working, excuse me. Okay, into our next slide here on 24. The internal female organs that we've been talking about, these are all going to be also retroperitoneal. By now we know what that means, right? Retroperitoneal, right behind the peritoneal sac. And they're all going to be these internal organs, all retroperitoneal, except the ovaries, okay? These are going to be supported and suspended somewhat freely by these ligamentous folds of peritoneum, okay? And there are several of these ligamentous structures, but for the purposes of this course, all you're going to have to be responsible for is the broad ligament, which we see highlighted over here on the left, right? And that's going to be composed of what's called the mesovarium, mesosalpinx, and the mesometrium. We're not going to get too much into what those mean, but you know, they're not going to be tested, these substructures. I just want you to, you know, be able to identify the whole ligamentous structure up here, just superior to the ovary, okay? Right, and slightly inferior as well. This whole broad ligament is what we're talking about, this large flap, okay? This is not to be confused with, for example, the ovarian ligament, which we see over here, right, connecting the ovaries to the uterus, or the suspensory ligament up top over here, or these round ligaments of the uterus. All right, these are all different little ligaments, but I just want you to be familiar with this broad one that kind of surrounds the ovary, okay? So let's just run through some of these other landmarks, right, just so that we can get oriented, right? If we want to, if we're not quite sure where we're looking, there are a few landmarks that we can look at to figure out where we are. So first of all, just like we saw in the male reproductive system, we have the pubic symphysis, right? That's going to be this bone area over here in the anterior portion, the pubic symphysis, right? We're going to always see that anteriorly, always anterior, right? That's going to be toward the front, the pubic symphysis. We have the rectum and the anus, right? It can be a little, occasionally hard to tell, right? Especially in like a cadaver, for example, because the rectum isn't always going to be this patent, this open. It might be a little bit more narrow and kind of resemble what we might see in the vagina over here, right? Nothing is, of course, as clear cut as we see on the diagrams. But you have the rectum and the anus, and that's of course going to be located more posteriorly to some of these other external genitalia that we see in the female reproductive system. Of course, we have the bladder, right? We have the bladder over here, the urinary bladder, which can also, I understand, be sometimes tough to distinguish from the uterus. You should just take note of the fact that the urinary bladder will typically it'll be located inferior, right? More inferior than the uterus will be. It's typically, even though it is very muscular, it's not going to be as muscular as the uterus is, at least in a non-pregnant specimen, right? And when it comes to the uterus, you're going to have a much longer canal, which is going to be the vagina over here. That's going to be located posteriorly to this canal, this shorter, more narrow canal that we know as the urethra, right? We, of course, if we have the urethra, you have the urethral orifice, right? And the urethral orifice is going to be a much smaller orifice, much smaller opening than we are going to see with the vaginal orifice, right? The opening into the vagina. And here we have our fallopian tubes, right? And these are going to be connected to an ovary. And of course, these ovaries, you know, if trying to figure out whether this is male or female, these ovaries are going to be located far more superiorly, albeit not in the retroperitoneal space like everything else. They're going to be much higher up than we would see the testes located, right, in males, which would be much more inferior, housed within that scrotal sac. Okay, now let's jump into some accessory glands, namely the milk-producing or lactation regulating mechanism, which we know as the mammary glands. The mammary glands, these are going to exist within the breasts in both sexes, male and female, but they're typically going to have a reproduction-related function only in females. This is not to say that males are incapable entirely of lactation. There are occasionally conditions such as gynecomastia, for example, which is the irregular development of breast tissue in males, typically due to higher estrogen levels or lower testosterone levels, or high aromatization, transfer between testosterone to estrogen. This will typically be seen usually in a pathological regard in males, and sometimes, yes, lactation does take place. But if we're speaking about the more typical infrastructure, we're only going to see the reproduction-related function in females. And since the function of the mammary glands is, as we know, to produce milk to nourish the newborn infant, their importance is more closely associated with events that occur when reproduction has already taken place, right? After birth, right? Periodic stimulation by the female sex hormones, especially estrogens, are going to increase the size of the female mammary glands at puberty. And during this period, the duct system, again, the pipes, right? The duct system is going to become much more elaborate, right? And then you're also going to have a lot more adipose tissue deposition. So fat will be deposited. Fat deposition is going to be a much more important contributor to increased breast size during puberty, the budding of the breasts initially, and this is usually going to be largely due to the deposition of fat tissue, not so much the increasing complexity of the ductal system. But moving on, the general mammary gland, as we can see, the female breast tissue, we have the external and the internal view. We have the prosected view on the left, and then we of course have the external view on the right side of the left, right? And so this rounded skin covered mammary glands are going to lie anterior to our pectoralis muscle. Okay, we can see our pectoralis major, which we're, I'm sure, all familiar with by now. The pectoralis major muscle, we can see, is quite thick over here. We also have some of these intercostal muscles that we see in between our ribs. Here's our first rib up here. We have these intercostal muscles all throughout. We have those, you can see there's a couple layers there, right? So that's one way to become a little bit oriented, right? Of course, we're going to have the breast tissue in front of the pectoralis muscles. And they're going to be attached to the body. They're going to be attached to these pectoral muscles by connective tissue. So slightly below the center of each breast is going to be a pigmented area, which is known as the areola. And this is going to be surrounding a centrally protruding nipple. And this is going to be what the baby latches onto while feeding, right? While breastfeeding, baby is going to latch onto the nipple. And if you notice, sometimes there are occasional little bumps kind of surrounding the nipple on the areola. These are known as Montgomery bumps, sometimes known as Montgomery glands, and their function wasn't too well known for a while, but now it's being proposed, from what I understand, that this helps with allowing for better grip of the baby while latching onto the nipple, right? It allows for some friction and for the baby to better identify and latch onto the nipple when breastfeeding. Okay, so onto this next slide over here. Internally, each mammary gland, and of course there are two, each mammary gland will consist of 15 to 25 lobes that are going to radiate around the nipple, right? We're looking from an anterior perspective at this diagram, around the nipple. And they're going to be separated by fibrous connective tissue and fat, which we know is going to be the largest contributor to the increasing breast size during puberty. And of course, in the case of weight gain, you're also going to see increased fat deposition in the mammary glands, in the breast tissue as well. So these are going to be the 15 to 25 lobes radiating all the way around. Now, within each lobe are going to be smaller chambers called lobules. Okay, lobules. And these lobules are going to contain the glandular alveoli looking things, right? Kind of like we saw in lungs. Glandular alveoli that produce the milk during lactation, right? So the alveoli of these lobules are going to pass the milk into a number of lactiferous ducts, they're called, lactiferous ducts. And these are going to be the ducts associated with lactation, with the mammary glands. And now, these lactiferous ducts, which we can see kind of over here, these little pipes, they're going to join together to form an expanded storage chamber. Okay, the lactiferous sinus, as it's known as. This is going to be kind of like an ampulla of sorts, right? And a widening of these ducts. So it's going to be a lactiferous sinus, is called, and that's going to be usually toward, closer, more proximal to the actual nipple, right? So these storage chambers are going to be, these lactiferous sinuses are going to be located a little bit more proximally to the nipple. Now, these sinuses are going to, of course, open to the outside environment at the nipple. And the description of the mammary glands that we just, that we just covered, this only applies to nursing women or women in the very last trimester of pregnancy, right? This is not going to be taking place in someone who is not pregnant or who was not recently pregnant, right? So let's just run through the slide again really quickly. We have these mammary glands composed of about maybe 15 to 20 irregularly shaped lobes, and the smaller sections, which are called lobules, right? And these lobules are going to have these alveolar little sacs that are going to be responsible for producing that milk. Those alveoli are going to empty into the alveolar ducts, and we call these the lactiferous ducts. I'll take alveolar ducts as well. That is typically more associated with the lungs, right? The alveolar ducts. But, I should know what, I do know what you guys mean, so I'm not going to be too mean while grading on this exam, but I would prefer lactiferous ducts if you want that those brownie points. But anyway, those lactiferous ducts are going to come to a storage chamber as we approach the nipple, and we're going to call these the lactiferous sinus. Lactiferous sinus. Okay. And then finally, those lactiferous sinuses are going to empty into the nipple itself, which opens to the outside environment. Usually during breastfeeding, right? Sometimes there is, pumping. There are pumping mechanisms, pumping machines that you can use to release the milk preemptively ahead of time, so you can just have it in a bottle and feed your baby, on the go, or just have it there. Some people freeze it. There's some very important composition of breast milk, mainly in the earlier stages, called colostrum. Colostrum has a lot of really important immune roles, right? It has, a kind of a different breakdown of macronutrients and a lot of immunoregulatory substances that really help to build up the baby's immune system. So occasionally, from time to time, or quite often actually, we'll see that babies are very sensitive to breast milk and need to be given formula, which, while not exactly the mother's breast milk, it does, nowadays there are ingredients and there are formulations that really mimic this colostrum quite well, right? It's not going to be, of course, the brand name, so to speak, but there are advancements every day that allow for this. Okay, let's move forward a little bit. Okay, here's another look at what we were talking about. Interestingly, you might not have known this, but mammary glands are actually just modified sweat glands, right? So we talked about these different sweat glands, right? Sudoriferous glands and whatnot in the past semester. So these function very similarly, right? The non-lactating breast is going to be composed of adipose tissue, collagenous tissue, and a very small amount of glandular tissue. Now, if lactation is indicated, right, if the hormonal, like the prolactin levels and estrogen, progesterone levels are appropriate to stimulate lactation, then we're going to see the formation of more and more of these alveoli sacs lined with milk-secreting cells, and we call those milk-secreting cells lactocytes. Lacto, milk, cytes, cell, milk cells, pretty much. Okay. All right, and we have this cadaveric image on the right. Right, you can see how it's largely composed of adipose tissue. You can see the nipple in the middle, surrounded by the areola, occasional Montgomery bumps, and the pectoralis major in the posterior portion, right, lining it in the back. And that about covers it for the human male and female reproductive anatomy. Okay, here I posted just a few slides showing some of our in-lab models. I encourage everyone, I don't want to give everyone the answers now, right? If you do have questions, please do reach out to me. I'd be happy to elaborate. But I put these up just so you know kind of what to look for in the lab. But I encourage everyone, please do get into the lab at some point this week, if you haven't already, of course, and make use of the fact that you literally have most of the test questions right there at your disposal. You just have to take it, right? So take pictures of the models. Make a video of your own where you point things out on the models and explain to yourself what they are. Teach yourself, right? This is the Feynman technique. This is one of my favorite ways of learning personally, right? I would just go onto like my Notability, like what I'm using right now, this software, and go through my notes and talk to myself and say, okay, I look at the slide, I'm like, okay, this is what it's on, and I'll explain it to myself. And if I get lost, then I can look back at the slide and try again. I'll explain to myself. So that if I'm driving in the car, right, I have an hour and a half sometimes commute from home to Marist campus, right, an hour from home to New York Med. So I have time. I'm commuting. I'm driving. I like to drive. As narcissistic as it might sound, I'll occasionally just listen to myself on the radio, right? I'll listen to myself explaining to myself, right? I'll pause from time to time and I'll say, okay, this the lactiferous blank is in charge of the transportation of breast milk. Fill in the blank, and I'll just pause. And I'll let me in the future, who's listening to that, be like, oh, the lactiferous ducts. Oh, the lactiferous sinus is the enlarged chamber. Oh, and okay, then I'll talk to myself, kind of. It's very, very crazy and strange and weird and might require psychiatric evaluation down the road, but it got me the grades that I needed, and that's exactly what I want for you guys. I want you guys to absolutely demolish this exam, right, by whatever means necessary. And, you know, historically, students have shared with me that they use that technique, and these have almost exclusively always been the top scorers every time, right? They're making videos and pointing things out, right? They're teaching each other in the lab. They're bringing a group of friends, and I won't comment on the lateness of some of the videos I've received of 3, 4 a.m. people hosting their own mini lectures in the lab. But that's I'll turn my a blind eye to that. Sleep is important, people. Hello, gotta get your sleep. But it works for them, right? They're teaching each other, and that by explaining what you do know, you understand what you don't know. You'll start fumbling. What was it? Then you know, okay, I don't really know this as well as I thought. Let me go back and check, right? Test yourself. Get things wrong, people. If you get things wrong, it's been proven in studies time and time again. Getting things wrong and failing is a much better learning device than getting things right and rereading. And that failure, getting something wrong by self-testing, is going to stick in your brain a lot better than if you read it and got it right. Okay, so don't be afraid to fail, right? Fail now so that later you can just kick butt on the exam. Okay. Anyway, if I'm being completely honest, before we jump into this, the Mink identification, if I'm being completely honest with you guys, I'm not necessarily endorsing this, right? This is the disclaimer, but you might be able to get away with not being in the lab every single day while studying if you just get in there early, hopefully, before the weekend, right? And do a mass review of everything you need from inside the lab. Go through every model that might show up on your test. Look at several slides under the microscope or even online. Put all this info, take all these images, these videos that you've taken of anything that possibly could be tested in one place. So if you want to review models, you can just pull out your phone, right? Look at your pre-recorded videos instead of having to haul yourself and all those books back to the lab again. And, I get it. Listen, working smart beats working hard, guys. And working smart while working hard is unbeatable. Okay, use the technology we have available to your advantage, right? I'm a bit older, right? But I try to keep it G with you guys. I'm hip and young and with it. So gone are the days of reading and rereading a textbook to prepare for a test. We have access now to things like our phones, YouTube, Anki, Quizlet, even ChatGPT. And it's not an English class. I'm not asking you guys to write essays or anything for me in this class. So personally, I have no problem with you using AI tools to help you learn the material. But just be careful because, AI is not always correct. There are errors, and I've seen it before myself. So you should always double check and cross-reference with reputable academic sources before anything. But okay, that's it. I won't belabor that point much more. I just really do want to see you guys dominate the material, conquer this practical exam. Again, always feel free to come to me with questions. There are no stupid questions in this course. If you truly did your due diligence to try finding the answer independently, but you still find yourself stuck, that's okay. I welcome you. Please come to me and I'll do my best to clarify or fill in any missing pieces. Now, I live far away from campus, but we live in the technological age where I'm just a text away. I'm just an email away. We can do some office hours. I love doing office hours. So that's perfectly fine with me. We'll set a time. Okay? All right. Spiel over. Now, moving on. We have a couple more slides with models that you should be taking a look at. Right? So here's one with a cadaveric donor on the right. We're not going to, of course, have any cadavers in this practical, but just to kind of give you a perspective. On the left, we have another model. Okay, here are a couple sagittal sections that you can bet are going to be on your practical. So, you know, get familiar with those. Anyway, now, let's wrap up by going into some of the Mink structures that you guys should be aware of. Okay? Mink identifications. Here we go. So let's take a look at this schematic or diagram first so that we have a good general idea of what we're supposed to be looking at for, or looking for, rather, during this practical, right? We want to get familiar with the anatomical locations, the orientations of our Mink specimens. And, you know, granted, they're pretty similar to the human specimens, but they are different in their own respects, and we should become familiar with that before. We don't want any surprises on the practical, right? So I'm sure everyone remembers my suggested tip for identifying structures in an actual specimen, or even a model for that matter, and that is going to be backtrack, right? Fill in the blanks, connect the dots, right? So first, identify structures that you know for certain are what you think they are. So, for example, let's look at this image over here. This is just a schematic, right? We'll try to imagine that it's not labeled. But what in this diagram is abundantly clear to me and must be what I think it is? Well, for me, that would be the kidneys, right? First of all, there are two of them, right? They're paired organs, we know that. If I were in a mink, right, I'd see that, you know, if I was looking at a mink, the whole mink, I would see that they were located in that retroperitoneal space toward the posterior aspect, right? Or in the case of the mink, the dorsal aspect of the body cavity. I can clearly see that uniquely distinct kidney bean shape of each kidney, right, with the greater curvatures facing more laterally, and that smaller curvature where we'd find the hilum, singular. So this must be the kidney, right? Okay, so now that we've confirmed that these are definitely, we confirmed it, these are the kidneys. Now we can start connecting the dots, so to speak, right? What do the kidneys associate with? The bladder. How does it do that? Well, via the ureters. Okay, so let's look for two long tubes coming out of the kidney that ultimately lead to a big muscular sac, which we know is the bladder. And, oh, well, what do you know? We found them. Excellent. So now that we know that this is the bladder, and these are the ureters, and these are the kidneys, okay, let's look inferiorly to find what? Yes, the urethra. Okay, of course, because the urethra is where the bladder empties into, right? Okay, so we know the bladder empties its contents into the urethra so that the urine can be expelled into the external environment. Now, if we trace all the way down, we'll notice that this is a relatively elongated urethra, right? And that might hint to us toward the fact that this is a male mink. So let's confirm it. If that is the case, we should probably keep an eye out for testes, right? The male reproductive organ. And indeed, if we trace backwards up the urethra, we do find these little tubes connecting to these little oval-shaped testes on either side of the urethra, right? These tubes, which we now know must be the vas deferens, right? The ductus deferens, however you want to refer to them, along with the associated vasculature, right? That's what we would expect. The vas deferens, the associated vasculature, the nerves, we expect to find these encased within the spermatic cord. Oh, here it is. We have a spermatic cord. That makes sense, right? We have that connective tissue covering around these important long structures. Okay, so right there, guys, based on the knowledge we derived solely through logic, we can fill in the rest. For example, since this is undebatably a male specimen, we can look just inferior to the bladder and assume that this little glandular protuberance over here is more than likely the prostate gland, right, which houses the prostatic urethra. We can assume that the elongated section of the urethra, which we now know to be the spongy urethra, is housed within the penis. So it really is just a matter of starting small and connecting the dots. And of course, though, this requires a strong foundational understanding of the actual material and the anatomical landmarks. And that's why I suggest reviewing the slides and diagrams before jumping into the models and Minks. Right? You can do them, side by side. It might make it a little bit harder, but failure is a good thing when it comes to studying, as we just said. But for me, it just makes a little bit more sense when you know what should be connected to what, right? So here's a closer look on slide 35. Here's a closer look at what you guys can expect to see on the practical, right? As always, you guys can expect relatively clear and defined specimens. The samples we'll provide are going to be pretty clear on your practical. We're not going to give you some awful dissection with wax exploded everywhere and connective tissue floating around. No, we're going to look for the best and clearest possible examples to test you on. So worry not. Just like we did in the last slide with the diagram, we just need to identify some obvious landmarks, right? And fill in the blanks. So if this were an exam, you'd obviously have a full Mink in front of you. So we can assume that, there would be two very obvious kidneys somewhere right around up here. And from that, we can use the same logic that we just used to walk us through the rest. Okay? I won't do it again over here for the sake of time, but I'll let you guys, hopefully you can pause this and try to do that yourself. Try to, identify some of the major landmarks that give away the rest of the major landmarks. So if we zoom in a little bit more here on slide 36, we can get an even better look at some of the smaller structures that we need to be able to recognize on the practical, right? We can see the ureters over here, very small, right? The rectum over here looks like it's distended, so it's probably fecal matter within. We have the urinary bladder directly anterior to that, right? The vas deferens, which we can see is going to leave through that inguinal canal down into that spermatic cord we can see here on the left, and that will ultimately connect to the testes, right? You see that epididymis kind of capping it over there on the top. And we can see if we have the urinary bladder here, if we look just inferior, we have this little protuberance, this little bump. We can assume that's the prostate, because the prostate is always going to be, right inferior, right below, along the urethra, right below the urinary bladder, right? So that's probably our prostate, and as we know, it's labeled, so it is our prostate. And we're going to just keep on going down, right, through that prostatic urethra, the membranous urethra, and through the spongy urethra, which is where we can see now we have the penis showing up here at the inferior portion of the image. We can see that popping up, and that's going to be the majority of the length of the urethra in the male. Okay, so just use these little tricks. Okay, and we can do the same thing with the female Mink anatomy. Granted, this is a little bit, maybe harder to identify some of the landmarks, but that means you can just use the absence of certain landmarks to your advantage, right? The lack of testes, the lack of a spongy urethra, of an elongated spongy urethra, the lack of a penis, right? The presence of these ovaries over here. You can see the fimbriae, right? You can see the urinary bladder. You guys are going to have to kind of break it down and look for what should and shouldn't be there, right? There are certain things that are present in the male specimen that aren't present in the female specimen. So let's move on to this next image. We get a little bit of a closer look. We can see that the vagina is over here, down here. It's going to be much shorter, right, than what we would see with the male penis extending a lot further down, more caudally. The pubic symphysis has been cut over here. Here we've identified the urinary bladder, right? We can identify the urinary bladder the same way that we do, did before with the kidneys, the ureters leading into the urinary bladder, right? This colon on top here, it may or may not be present on your practical, so let's become familiar with both options. This colon looks to be a little bit more relaxed, less distended with fecal matter. So we have the body of the uterus, which is actually a little bit tough to see in this image. But we do have the lack of testes down here. We have the vulva down here. All right. Take another look at this image, 39. We can see these ureters a lot more clearly leading into that urinary bladder. the body of the uterus. So this clearly is not a pregnant specimen, so the uterus is not going to be particularly large. The bladder will be larger than the uterus, so we can expect to see that slightly superior to the urinary bladder. Here's the urethra. We have the vagina, the vaginal canal extending downward inferiorly, and there is no penis, there are no testes, right? We can see the ovaries kind of suspended upward over here, a lot more superiorly placed than we would expect to see the testes, which would be a lot more lower down. We can see the fallopian tubes, right? You can kind of make out some of the fimbriae here. And that's really all you need to be aware of, right? If someone's pointing, for example, if I put my pointer on here, look to see, okay, what is connected to this one organ? Oh, we can see there's a connection here and here. Oh, that must be the uterus then, and not the urinary bladder. Because if it was the urinary bladder, which I'd be pointing to here, then we'd see the connections going up, right? And up into the kidneys. And that's not the case. So these little things, guys, right? Another look. This is just kind of a close-up view of what I was talking about. Again, it's not abundantly obvious, which is why you got to practice. You got to practice. You got to look at different specimens and online models. Look at your Mink dissection guides posted on Brightspace, and just do the best that you can, right? It's not only the presence of structures, but also the absence of structures that can be indicative of the right answer. Over here, we just kind of have a male and female kind of chart, right, of the reproductive structures and their functions, and we'll see that corresponding homologous structures in the two sexes are placed in the same row, right? So the scrotal sac, the vulva, right, or the labia majora and minora are going to be included within that vulva description, right? The testes, the ovaries, right? Epididymis, oviduct. The urethra, right? They both have urethra. The penis, the clitoris. This is the erectile tissue. Okay. And if there isn't an analogous structure, right? If there isn't a corresponding homologous structure, then it won't be. They won't share the same row, right? Seminal vesicles. There's nothing like a seminal vesicle really over there, or at least nothing that we can see on the Mink, right? Okay, and what are we at? An hour 37. Not too shabby. All right, that is it, my friends. That is all. That is all we have for today. I wish you all the best of luck in your studies. I know you guys got this. You guys killed it in A&PII 1, right? If you had fun studying there, do it again here, right? And if you didn't have fun, switch it up so to make sure you have fun studying. You got to enjoy studying a little bit. It can't be all horrible and miserable and a dragging, grueling process. Make it fun, gamify it, enjoy yourself, and realize that, with every slide, with every question, with every model that you look at, you're bringing yourself closer and closer to whatever that dream may be that you envision yourself in, in the years to come. And I believe in every single one of you. I'm very grateful to have had the opportunity to instruct you guys this past semester. It's truly been such an enjoyable experience for me, and a major learning experience for me as well. You guys taught me a lot more than you know, and for that I'm very grateful. You guys are a fantastic group, and I really look forward to working with you guys professionally and socially in the future. Right? You guys are fantastic. You have excellence in your future, and I'm sure this practical will be another way for you to prove that to the world. Okay? And for the last time of this semester, this is Professor Youssef signing out. Good luck.